Colitis Foundation of America is joining us this morning with more. Good morning to you.
Good morning.
What are some of the symptoms and how do you define Crohn's disease?
Sure. So Crohn's disease is really an autoimmune digestive disease.
Okay.
And symptoms can really run the gamut, but generally speaking, we're talking chronic diarrhea, throwing up, bleeding, serious things that will hit your radar as something unusual.
I actually was in and out of the hospital a few times. The first time I had an abscess, which is can be a side effect of it. And yeah, I was in the hospital for that for about 2 weeks. I had the surgery. My brother actually had it twice, but I had the surgery in, let's see, spring of '06. And I remember when I first showed the signs of it, we were walking down South Street here, and we were with a couple of my friends, and we only walked like a couple blocks, and I was like so winded because it was like I had like really low blood count and stuff, and I had to keep on taking a lot of breaks from walking a lot. And yeah, and they like took me in the hospital. Found out, like, the doctor told me that he had to pull my dad to the side, and he was like, you know, I don't know why your son isn't like screaming in pain right now, because he said that my pain level was off the chart.
Have you ever been scared?
Yeah.
Well, I didn't really think I had any symptoms till I was diagnosed, and when I was diagnosed it was pretty severe. I'd say out of a 1 to 10, I'd say a 10. I take Pentasa, which is an anti-inflammatory, non-steroidal anti-inflammatory. I take that 4 times a day, and that's about it. I've been pretty lucky. I didn't require any surgery. I did spend 2 weeks in the hospital, though. We were coming back from my daughter's graduation in Florida, and I got sick on the way home in the car and went right to the emergency room and spent 2 weeks in the hospital, but luckily didn't need any surgery.
Well, Crohn's disease is still poorly understood. There seems to be some genetic link. It tends to run in families. But what we do know about it, it seems to be an autoimmune disease that causes inflammation. So something in the body is recognized as foreign, and the body tries to fight it off. And the manifestations of that inflammatory insult are usually limited, or most pronounced, I guess, in the bowel. It can affect other areas of the body, but the bowel is sort of what most people think about. If the inflammation is very severe, the bowel wall can get very thick, and if it gets thicker and thicker and thicker, it can cause a narrowing or obstruction. And sometimes that'll respond to medicine, and sometimes not. The single most common area of bowel that's affected is the terminal ileum, and that's the last segment of the small bowel, just as it joins the large bowel. Most will present with GI symptoms, so abdominal pain or diarrhea or problems with growth. And in some cases, if the medications don't work and the disease is advanced, then surgery plays a role.
I had abdominal pain in my lower right side. I lost a lot of weight in a short period of time, and I was getting sick a lot, which I guess is signs that my immune system was weak because it was fighting off a flare-up of Crohn's disease. I have it fairly bad, I guess you would say. I had a second surgery in '06. In the first surgery, I had 24 inches of my small intestine removed, I believe, and in the second surgery, it was about half that, about a foot. So I've had surgery twice, and since my second surgery, I've been doing well, though. I'm on a drug called Humira, which I inject in my stomach every other week. It also does a really good job of keeping my flare-ups down. The pain was about as intense as anything I'd ever experienced.